My name is Liesje Turner. Thank you very much for the invitation to share our recruitment experiences with you today. Much of our success has been down to developing an approach and an infrastructure which tailors to international recruitment. So my focus today is going to incorporate some of the approaches that we have taken in that regard, and also how we've gone about setting some targets to deliver. So I've tried to capture some of the key points from a number of areas, and it's important to highlight that actually we're on a learning curve ourselves. We haven't got it perfect, and there are still improvements that we are striving to make with our recruitment approaches. However, we have been doing international recruitment for a number of years, and we're definitely now in the refine and improve phase as opposed to the storming phase. So next slide, please. So hello, my name is Liesje Turner. I am the Head of Strategic Recruitment at University Hospitals of Morecambe. I originally joined the NHS in Scotland in 2003 as the Agenda for Change Project Implementation Lead. And then I went on to undertake a workforce planning role, then moved into an equality and diversity lead role. And then in 2012, I moved to the NHS in England at a community partnership trust as an HR business partner before moving on to head up the HR business partnering function. Subsequent to that, I joined Morecambe, initially covering somebody's maternity leave, part of the cultural transformation and inclusion and diversity remit, and following on from that joined Morecambe on a permanent basis, and now I'm the head of strategic recruitment. So my role covers many aspects of attraction and retention, including inclusive recruitment, looking at retention, new hire and exit strategies, looking at international retention, careers and engagement, so the future workforce, and also the Global Radiologists recruitment programme, which we'll talk about today. So next slide, please. What about Morecambe then? So the University Hospitals of Morecambe, we operate in an area which spans 1,000 square miles in Cumbria and North Lancashire. And we have hospitals in Kendal, Barrow and Lancaster. We have a range of hospital services, including full emergency departments, critical coronary care units, and various consultant-led services. And all three main hospitals provide a range of planned care, including outpatients, diagnostics, therapies, day case and inpatient surgery. Next slide, please. So the structure I'm going to use today then, I'm going to talk about each of the areas that I want to focus on. I'm going to set the scene. We're going to look at the actions that we've set out to achieve, highlight any obstacles that we have come across, and also share the outcomes of the work. And finally, I will do some top tips from our perspective. Next slide, please. So when I was asked to be part of today's session, I did find it quite tricky to decide which element of our recruitment I should focus on. So set myself a challenge of covering three key strands. They are our approach to international nurse recruitment, which has contributed to our successes around being a really robust vacancy position today, the Global Radiologists programme, and the International Retention Programme Board. What you'll see at the end is that some of the top tips that I've picked up on, there's overlap across all three areas that we're going to look at. Next slide, please. So if we start with nurse recruitment then, in 2017, our nurse vacancy position was very bad. We knew that the national landscape and context was bleak, and you will all know the narrative for yourselves. So not enough in training, not enough people in training, an ageing population, including an ageing workforce, and more complex needs and greater demands for patients. So we needed to try something radically different, and we did decide to take a brave pill and not just dabble in the international market, but actually exploring it on a strategic basis, making it a really big commitment. So one of the key aspects of that was to secure support from the HR director and senior nursing colleagues, including the director of nursing. So that was the first step to our success. Next slide, please. So given our relative inexperience at the time, we recognised that there was a need to establish a partnership with an external provider, and I realised that there are a number of other organisations who provide routes to international nurse recruitment, but our longest standing and most successful to date has been with an organisation called Jane Lewis International. And we were keen to set a partnership with Jane Lewis because they were also committed to the principles of compassion and care, and we wanted to work with people who shared those same values, so that the best possible support could be provided to our incoming nurses. So we had the same values and principles around care, compassion and support, and really seeing the individual at the heart of it. We needed to be clear on what we were trying to achieve in terms of numbers. So we trialled a target setting methodology for all nurse recruitment, which we have refined year on year since 2017-18. So for example, if we look at the year 2020-21, what we do is we take our current gap, so what is our existing gap in our establishment, what is our predicted maternity leave, so we would base that on sort of previous years maternity leave, and what is our predicted turnover, again based on previous years data. So for 2021, we added that, and then we factored in a vacancy tolerance percentage, which we were prepared to accept. So for that year, we set out to recruit 244 nurses, and our actual figure, you will see, is not far off that. And you'll see later in the slide that shows that this target setting methodology that we have refined year on year has helped us to achieve our current position. We also needed to ensure that the pipeline of international nurses was ethical and sustainable. So recruitment campaigns were undertaken in person on a number of visits to both the Philippines and India. Next slide, please. So our main barriers to international recruitment were really inexperience, so refinements and improvements we have now made as a result of our experiences mean that we're in a much stronger position. It's a much slicker operation than we first set out. Resource and capacity, so I think that probably the time and effort that it takes to recruit and successfully onboard international nurses cannot be underestimated. And a critical factor here is the relationship between the nursing team and the recruitment team. So it's very, very close working between the recruitment team, the pastoral leads and the nursing team themselves, and also the practice education facilitators. So it's a really strong team feel across all of those disciplines. Timeframes was also a barrier. So if we put COVID to one side, the timeframes initially from recruitment to starting in post could be anything from 6 to 12 months. And more recently, we're seeing timeframes from interview to arrival in country can be as little as 4 to 6 weeks. So we've got much better and much slicker at that process as we've become more experienced. Next slide, please. So the outcomes then, this slide speaks for itself. I think our current nurse vacancy position is probably one of the reasons that I've been asked to come and talk today. So not only is the position a really strong position, we've also continued to have a pipeline of nurses ready to join, which will accommodate any flux in turnover that we might be anticipating as a result of COVID burnout, etc. So our focus now, as much as recruitment, is about how to retain our colleagues once we get them here. Next slide, please. And I'll talk about retention a bit later on. But if we move on to another of the Morecambe recruitment initiatives, these next few slides will take us through the Global Radiologists programme. Next slide, please. So the Global Radiologist programme, similar story in terms of setting the scene. There's a national shortage of radiologists, and it was time to try something different. With an appetite for initiative and creativity, we partnered up with a number of organisations, which I'll come on to shortly. So just a quick look at the background then as to why we needed to try something differently. This visual has been taken from the Royal College of Radiologists workforce census that was done in 2018. And I don't think the 2019 census, workforce census told any different story. So it highlights the significant workforce challenges and provides some quite startling facts. So if we just take a couple of examples, so 98% of trusts unable to meet their reporting requirements, an anticipated shortfall of 1,867 radiologists by the year 2023, 3 in 5 consultant radiologist vacancies remaining unfilled for a year or more. So at the heart of what we do have is patients who are not receiving the level and pace of care that they deserve. So next slide, please. So the programme was set out to achieve an improvement in that position for patients, and there are 4 partners in the programme. Health Education England is the commissioning partner and also provides project management support. Health Education England forged links between the partners, which has culminated in the development of the concept. Apollo Radiology International is an organisation based in India which has strategic workforce links to Indian radiologists who are looking to undertake their FRCR2B exam. So that's the exam that allows people who have trained overseas to achieve their GMC registration. So Apollo's role therefore was a candidate sourcing and candidate management perspective. The Royal College then, because of the FRCR2B exam is a Royal College exam, so the Royal College oversees and manages that part, that critical element or that critical pathway to GMC registration, and plays a role in ensuring that candidates are given the opportunities to undertake the exam, and this has included putting on additional sittings of the exam, which are now starting to take place in Hyderabad in India, and hosted by Apollo Radiology International. So on the back of the successful pilot, which we ran in 2018-19, where we had the responsibility to test the concept, the decision was taken to scale up the programme, and our role now in the programme is to share and promote the potential of the scheme, and to secure host trust participation. So that's NHS trust participation in the programme. So if any of you are working in trusts where there is a shortage of radiologists, then please do get in touch with us, because the programme, despite COVID, is continuing. So the scheme is branded as a non-migratory programme. This means that for sort of ethical recruitment reasons, it means that it's an earn, learn, return programme. The Global Fellows, Global Radiologists, come on a Tier 2 visa with the view to them returning to India following on their 3-year placement. So the earn element is that they're earning whilst they're learning on the job. The learn is that they are given the opportunity to specialise in a subspecialty, which is not something that is readily available in India. A lot of the approaches in India is it's general radiology. So they gain valuable NHS experience, and at the end of their 3 years, they are in a position where they can go back to India and be more likely to progress in their careers, but also take the NHS learning with them. That said, we know that a number of the people who are on the programme intend to stay in the UK, and a number have already within sort of 12-18 months are well through their CSER application and becoming a consultant on the specialist register with a view to staying in the UK. One of the unique aspects of the programme is that they have an induction in India, so it gets them NHS ready. So it means that when they come to the UK, they are as ready just to hit the ground running. Next slide, please. So in terms of obstacles, COVID was a huge problem for us. just as the programme was moving into its national sort of scale-up phase in early 2020. Actually, we came back from some interviews at the end of January, and that's when people were starting to wear masks on aeroplanes and in airports, and then obviously the pandemic happened. So that was a problem for us. I think initially the people who were due to join us, who we'd interviewed in the January, did not want to come to the UK because of how the UK was perceived across the globe. So that kind of put some delays into the processes, and then following on from that, obviously the pandemic hit India, so then people weren't able to leave their current work. So there were some challenges put in there, but in terms of infrastructure, the fact that we had in place a host trust network and a radiologists network for the doctors themselves that we kept going despite COVID meant that we were able to overcome challenges and barriers in a sort of supported and connected way. Next slide, please. So in terms of the outcomes then, well, there's been a fine balance to try and deliver between the number of hospitals involved in the programme and the numbers of doctors recruited, so that we're not disappointing anybody, we're managing everybody's expectations closely. So far, we've managed to balance supply and demand. Again, it's not been perfect. Doctors can back out, change their minds for reasons. Trusts have been in positions where they've had to change their position. Yeah, on balance, we've been progressing well. There is actually a 3-minute video. Probably we don't have time to go through that today, but if you look at the slides, there's a 3-minute video. I'm just going to ask Laura, is it possible to share the video, Laura? Is that too technically challenging at this stage? I'm not hearing anything, so I'm assuming that's not an okay thing to do. Okay, so we can maybe share the link for the video that people can look at. But that video is a really brilliant video. It's 3 minutes and it takes you through the exact nature of the programme and how the partners each work together. Next slide, please. So the third area that I wanted to look at today then was international retention. If we just go on to the next slide. So in early 2021, on recognising the positive retention rate of internationally recruited colleagues at Morecambe Bay, NHS EI invited our trust to take part in a national action research project which is focusing on international retention. So it's in support of the people plan. And in the particular element of that is looking after our people. It's a 12-month piece of work which has been established to progress the development and evolution of how the NHS can best position itself for future international recruitment. So the national programme is looking at bringing together people who have various experiences across organisations and systems who've had high international recruitment levels over the last 24 months to see what good practice we can take and learn and share. So the focus that we're taking is we're looking at cultural integration, communication, support networks and individual challenges. So there is a focus on developing enhanced support offerings against those themes, and also developing some metrics so that we can really see the impact of our work and how that is contributing to not just the retention but also things like the career progression of internationally recruited colleagues. This is an opportunity to share experiences and practices and also refine our approach as part of this work. So it only kicked off in April this year, so we're around halfway there in terms of the programme duration. Next slide, please. So the programme board established a set of priorities which were agreed in month 4. So we had terms of reference, membership, and then did a priority session, and then we finally signed off the priorities that we need to look at in terms of really enhancing the experience of internationally recruited staff. So on this slide, we've just got a word cloud of those areas which were given a priority 1 rating, so that those areas that we needed to look at in the next 6 or 12 months. So one of the key aims for us was to ensure that the doctors that we're bringing in and allied health professionals are receiving the same support as our nurses. So I'm not saying that what we provide our nurses is perfect. Like I said right at the beginning, we've still got a lot to learn ourselves and develop, but certainly we've been able to identify that our nurses do get more support than doctors, so we need to ensure that we're providing as a minimum the same support to our doctors around that whole pastoral piece and that experience, and then the ongoing kind of development as we do for our nurses. And so one of the actions that we've implemented also quite early on in the programme is to look at providing that classroom experience. So with our nurses who come in who are going through their OSCE preparation, they spend some time, you know, developing relationships, spending time with other people who just arrived in the UK. We're going to look to provide that same experience, not necessarily OSCE preparation, but we've also developed that now into a ward preparation period where it focuses not just on the clinical skills, but getting people ready for systems and processes of ward working. And we're looking to bring the doctors into that. So once they arrive in the UK, not necessarily on a cohort basis, but have a set intake every month that we bring them all together in the classroom for ward preparation time. So that's just one of the improvements that this programme has made. Next slide, please. I suppose one of the barriers, again, to progress with this programme, even though it didn't start until April this year, was COVID, just in the fact that the person who was leading, our project lead, is a critical care nurse, and it took, following on from recruitment, it took us 3 months to get her released from her unit to drive the work forward. Also an international nurse herself, so has lived experience, so is a fantastic candidate to really drive those improvements. But it's just interesting how COVID can impact in so many different ways that you don't anticipate. Next slide, please. So in terms of our international retention programme board, then we have our terms of references in place, our programme board is established, our key membership is secured, our project lead is appointed, we've prioritised our prioritisation exercises completed, and we have monthly meetings, and we've just this week started to present at the National Retention Board as well, that's working with other organisations. Next slide, please. So the next 3 slides cover the top tips element of this session. So these tips have been taken through feedback, through experience, through natural improvement, and through our own learning and processes. And this slide here is based predominantly on feedback from our Global Radiologist programme. So many of them have the same principles across all staff groups, but that's where we've got the majority of this. So you might think some of this is common sense, but for obvious reasons, for some reasons, many of these aren't covered, so it's good just to reiterate or just to be really clear the important elements. And I think one of the things for me that I found really interesting is the use of WhatsApp with our global radiologists. We have a network, we have a group chat, and individuals message me regularly before they depart for the UK, and then once they're in the UK and once they're with their host trust, we still have a very active WhatsApp relationship. So that's for me is one of the really interesting top tips, is the use of WhatsApp and how helpful it is. Next slide, please. So this slide is a little bit busy, but in simple terms, we're talking about the concept, the people, the offer, and the support. So the concept was test it. So for the Global Radiologists, we ran the pilot first. For the pilot, we ran the selection process in India. It was a robust process which involved personality profiling, face-to-face interviews, stakeholder groups, technical assessments, and this culminated in the appointment of four global fellows. So the relationship, this is something that that's been really important actually with the success of program, and also, well, any of our initiatives, it's down to the people. So in terms of the relationships that people are able to make have been sort of fundamental for everything that we've done. You need people who are committed with the right values and principles. So although we've got a really sound sort of cultural foundation, there is work that we're doing to improve our approach to recruitment. And in terms of inclusivity, we need to take a look at how we recruit. So success factors include guidance, which we've taken from the CIPD report on inclusive recruitment. And our ambition is to establish a workplace which is effortlessly inclusive and an opportunity to bring some standardisation to our recruitment approaches. Next slide, please. So finally, just top tips 3 of 3 then, something about getting people ready before they join the NHS. So we've seen that in the Global Radiologists programme. We're now looking at how we can replicate that with other staff groups, the pre-joining NHS readiness, actual international induction, so on arrival in the UK, not just your standard local induction, not just your standard corporate induction, but actually there is a specific international induction on arrival to include key groups, things like BAPIO, BINA, getting people exposed to GMC, NMC, staff organisations. So a really robust international induction programme, which is specifically for internationally experienced colleagues, regular check-ins, so have that really personal touch, linking into events and meetings on arrival, and ensuring that colleagues understand the role and are prepared. So that's existing colleagues on the wards or in the departments, in the services. So one of the things that we've found is that we need to provide some support and development for those receiving colleagues, as well as the colleagues that are joining from other countries as well. Next slide, please. So in terms of what I wanted to cover today, that's everything from me today. I am very happy to hear from anybody who has any queries or questions about our work. I'm keen to point out that the Global Radiologist programme is still taking on post trusts, so we're still looking for placements. So if you do have a diagnostic service and you would like to know more, then please get in touch on that basis. But that was all I was going to say today, and I've got 3 minutes left. I'm not sure whether or not I was meant to leave any time for questions. I'm hoping somebody might speak to me now if I do need to take questions.
Yes, if you're happy to take questions. Does anyone have any questions in the group here?
Hi, Leslie. I was just wondering if you're able to give us some ideas about recruiting community nurses to work in the community. Have you had any experience of doing that?
So that is one of our biggest challenges, actually. So one of the things that we are looking at as part of our international retention work is supporting how we support our internationally experienced nurses to work in the community, because some of them do have a preference for community. So it's looking at designing and developing a conversion course with a local education provider. And also it's not just about the education and the conversion, it's also about equipping them. So one of the actions from the retention board is and this might sound a bit crazy, but we're considering whether or not we need to employ a driving instructor ourselves to provide driving lessons. So not just signpost for driving lessons and not just arrange, a partnership with a driving instructor, but actually potentially recruiting our own. Yeah.
Okay. Well, yeah, thank you for your thoughts on that.
Okay. Have we got 1 minute left? Anything else for anybody? Nothing? Okay. Well, thank you all very much for listening.